Welcome to Fitness Notion YouTube channel. In this video we are going to talk about the top 7 diseases prevented by workout. So before starting this video, like this video and subscribe to Fitness Notion channel for future updates. You are aware that exercise is beneficial to your health, but you are unable to find the time to fit in a workout. The following will provide additional motivation to get moving. A regular fitness practice has numerous health benefits that are not immediately apparent. People who engage in physical activity are far less likely than those who do not to develop chronic health issues. Even if you already have one of these disorders, exercise can help you control or reverse the symptoms of the condition. Experts discuss how physical activity and disease prevention are intertwined in this article. Fitness may benefit practically every cell in the body, according to Dr. Glenn Gesser, a fellow of the American College of Sports Medicine and professor at Arizona State University's College of Health Solutions. Exercise has a good effect on virtually every cell in the body, he adds. Those who are physically active have a lower risk of developing chronic diseases, whereas those who are sedentary have a higher risk of developing practically every major chronic ailment. According to Gesser, even if exercise does not treat a disease, those who exercise consistently and have chronic health disorders e.g. diabetes, high blood pressure, and high cholesterol will lessen their risk of dying from those conditions. Eric Asher, DO, an attending physician at Northwell Health, Family Medicine in New York, says exercise has a good effect on virtually every cell in the body. Others are frequently able to reduce the doses of their medications they are taking. Number 7. Diabetes. There is a direct inverse relationship between physical activity and diabetes. For patients with elevated blood sugar levels, I recommend that they walk after their heaviest meal since your muscles require glucose to function properly, says Catherine A. Bowling, MD, a primary care provider at Mercy Personal Physicians in Lutherville, Maryland. I recommend that they walk after their heaviest meal since your muscles require glucose to function properly. In other words, remaining physically active has a comparable influence on your blood sugar levels as drugs such as insulin do. For some people, it can aid in the natural reduction of hyperglycemia and the reduction of the need for medication. Number 6. Anxiety and depression. Exercise, particularly cardio-based motions, helps to increase your endorphin levels, which are the feel-good hormones produced by your body to combat stress. This encourages neuron and cellular growth, which, according to study, helps to alleviate depression and anxiety. As Dr. Asher explains, for my patients who are worried or depressed, I usually recommend an exercise plan in conjunction with counseling or medication, if appropriate. Exercising outside has even more advantages than exercising indoors. In the words of Dr. Bowling, being outside in nature is beneficial for your soul, and it makes people feel better. Working exercise in the great outdoors has been shown to increase psychological well-being in studies. Number 5. High blood pressure. Exercise has been shown to have a significant influence on patients with hypertension. This is due to the fact that the more weight you have, the greater your danger. If persons with high blood pressure adopt a healthier eating plan, begin exercising, and lose some weight, they may be able to reduce their medication dosage or perhaps stop taking their blood pressure medication, explains Dr. Bowling. If you have low blood pressure, you may be able to reduce your medication dosage or perhaps achieve a healthy blood pressure level that does not require medication. Number 4. High cholesterol. As reported by the Centers for Disease Control and Prevention, many people are able to lower their cholesterol levels without the use of medications merely by following an exercise regimen and making other lifestyle modifications, CDC. As Dr. Asher explains, cardio-based exercise routines are going to get the blood flowing and your heart pounding, and that is definitely beneficial in regards to weight loss and improvement in your heart health, both parts of reversing heart disease, high cholesterol, and diabetes. Number 3. Osteoporosis. Weight-bearing exercise is essential for everyone, but it is increasingly necessary as we age. Osteoporosis is a significant problem for women in particular. You don't want to reach the age of 70 and discover that your bones have become so weak that you have fallen down. You end up breaking your hip. Dr. Bowling explains, lifting weights or participating in weight-bearing activity puts stress on your bones, causing them to draw in extra calcium as a result of the tension. This makes your bones stronger and reduces your chances of developing osteoporosis or osteopenia in the future. Number 2. Dementia. People who suffer from chronic illnesses are significantly more prone to develop dementia. Even having your blood sugar and blood pressure within normal ranges makes a significant difference in the prevention of dementia. Dr. Bowling explains that having high blood sugar has consequences not only for your physical health, but also for your mental health. According to the Centers for Disease Control and Prevention, poorly managed chronic conditions might aggravate cognitive impairment. Number 1. Cancer. Through a variety of processes, physical activity lowers the risk of developing cancer. Overall, the favorable effects of exercise on insulin and insulin-like growth factors, as well as the reduction of the danger of chronic inflammation, reduce the risk of cancer. Gesser explains, Dr. Bowling explains that because being obese raises your risk of developing some malignancies, adding exercise into your daily routine can help you lower your risk by assisting you in maintaining a healthy weight. How much physical activity do you require? With regard to chronic disease, you may be asking how much physical activity is required each week in order to reap the disease-preventing advantages of physical activity. The Centers for Disease Control and Prevention advises at least 150 minutes of moderate cardiovascular activity, such as walking, per week, or 75 minutes of higher intensity exercise, such as jogging or biking, per week. Combining this with at least 2 days of weight training targeting all of your major muscle groups will yield the most beneficial results: back, hips, legs, arms, shoulders, and abdomen. If you're just getting started, any quantity of physical activity will be beneficial to you. In Dr. Bowling's opinion, even if you merely exercise for 15 minutes a day, you're improving yourself. And the more you do it, the more likely it is that you will be willing to do it for a longer period of time. Begin slowly and gradually increase your workload. If you add a minute or 2 to your weekly routine, you'll be well on your way to achieving your objectives. In general, cardiovascular exercise is the most effective form of treatment or prevention of chronic illnesses, although strength training is crucial for maintaining or developing muscle mass and strength. Besides improving functional fitness, Gesser notes that strength training lowers the risk of bone loss, osteopenia, and muscle loss, sarcopenia, which in turn lowers the risk of frailty in the elderly population. Symptoms that indicate that you should take a vacation from exercising. Stop whatever you're doing if you're experiencing terrible pain of any type. If you get chest pain while exercising, especially if it is accompanied by shortness of breath or excessive sweating, stop exercising immediately and call your doctor. Dr. Bowling advises, in the event that you have been sedentary for an extended period of time, you should check with your doctor before beginning a program of vigorous intensity exercise. Although the majority of people may add moderate intensity movement into their daily routines without experiencing any issues, it is always best to be cautious and consult with your doctor beforehand. Excessive fatigue and discomfort may signal that you've done too much exercise. Gesser warns, it's normal to experience some muscular discomfort when you first start an exercise routine, but it normally subsides within a week. Increasing the amount of exercise intensity, duration, and frequency gradually is the key. If you are experiencing any intense aches in your muscles or joints that are not going away, seek medical assistance right once. In the event that a workout doesn't feel right or is uncomfortable in any manner, it may not be appropriate for you. There are a plethora of options and customizations available to you. What do you think about this video? Do let us know down in the comments section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.